Advances in Health, I'm Rebecca Stewart. So many people suffer from osteoarthritis, and specifically when it comes to the knee, it can be debilitating. But there is new hope with new technology, and we are joined by Dr. Michael Lynch with St. Vincent's Medical Center, the newest member of Hartford Healthcare, to talk a little bit about Mako. And what was so interesting to me was that you were telling us that we don't actually replace the entire knee. That's a misconception.
Well, we do resurface the entire knee, and that's what I try to emphasize with patients, because replacing it sounds like we make dramatic changes and remove a lot of stuff. We really only take about a centimeter of bone at most from either end of the bone, and then this cap goes on to give you a new smooth bearing surface.
And tell us what we're looking at here. This is after surgery.
This is post-surgery, so this is the femoral or thigh component of the knee, and this is the tibial component, and this is the new smooth friction, low friction bearing surface.
What causes the pain in someone who has that terrible osteoarthritis?
Osteoarthritis is a function of losing the rubber coating or cushion called cartilage in the knee, and when that gets down to bone on bone, it sends off debris, creates inflammation, and that creates pain.
And then how does this take that away?
By resurfacing and recoating and replacing that surface, we're able to get rid of the pain.
Now, we were also talking about robotic navigation, and you said you want to be very clear that the robot does not do the surgery.
That's correct. The robot assists us in doing the surgery, but assists us in a way that it has tremendous information packed away inside it on the patient's anatomy, and it can help us to be much more precise.
All right, Dr. Michael Lynch with St. Vincent's Medical Center, the newest member of Hartford Healthcare. To learn more, head to WTNH.com/advances in health.